7 crew members on the USNS Mercy hospital ship in California have tested positive for the coronavirus as the state's governor unveils his plan to lift stay-at-home restrictions. NBC News correspondent Gadi Schwartz joins me now from San Pedro, California. That's where the USNS Mercy is docked. Gadi, what can you tell us about those 7 crew members? How are they doing?
Well, at this point, it seems like those crew members are stable. They have been taken off the ship and taken to a nearby base, as well as 100 other crew members of the Mercy here. And the reason why is because those 100 or so crew members were also exposed to those 7 crew members that did test positive for COVID-19. At this point, it's just a precaution that they were taken off the ship and isolated at a nearby military base. But they want to make sure that they are erring on the side of caution. The 100 or so have taken tests preliminarily. Those test results show that they do not have COVID-19, but a little bit of a mystery as to how COVID-19 got on board this ship. This ship came up from San Diego, and when all of the service members got on board, they were screened, the Navy says, for COVID-19. And so they're unclear how COVID-19 got on board because this ship is not here to treat COVID-19 patients. It's here to help alleviate some of the strain and burden on Los Angeles hospitals as they deal with COVID-19. Allison?
Gadi, we've been talking so much about contact tracing. Do we have any sense of what other people, who else they may have been in contact with, those 7 crew members?
That's what the Navy's doing. It's relatively easy to do on board this ship. There's still about 1,000 or so service members that are on the Mercy here, but they were able to track and trace down to the people that did come into contact with those 7 service members that did test positive for COVID-19. That tracking and tracing happened on the ship, and they took them off the ship and put them into isolation. But as far as where it came from, who was patient 0 really, who brought it onto the ship, at this point, that is still unclear. Allison?
You mentioned that ship docked in late March to relieve the pressure on local hospitals by treating non-coronavirus patients. Are those plans still on track?
Yeah, those plans are still on track. However, the silver lining out here is that this ship hasn't been needed quite as much as they wanted, or quite as much as they anticipated. Some of those projections had the hospital systems here in Los Angeles possibly being overwhelmed. At this point, it is still manageable. We are seeing the highest number of deaths and the highest number of cases reported so far, but the peak really seems to have flattened. So far, the Mercy has seen a bunch of different low-level traumas. There was a stabbing. There were a couple of surgeries that they did, but nothing like the surge that they were expecting. So far, things have been able to stabilize out here. But in the next week or so, we're expected to see the peak, and everybody here is hoping that those numbers just don't spike. Allison?
Yeah, Gadi, I want to ask you about the death toll there. We know LA just recorded its highest daily death toll from COVID-19. What can you tell us about that?
Yeah, LA reported its highest number. The state of California also reported its highest number. The highest number so far is right about 70. It's probably going to get a little bit higher than that, but based on the projections, not much beyond 70 deaths per day, which is still tragic. But so far, since the beginning of this, the entire state of California, a cumulative, from a totality standpoint, seen about 700 to 800 deaths. However, in New York, where you are, you've seen 700 to 800 deaths. That's what you're seeing on a daily basis. So far, California is still drastically lower than New York right now. Allison?
Gadi, we know Governor Newsom laid out what he's looking for or what he wants to see before he'll lift the state's stay-at-home mandate. What are the indicators he's using?
Well, the biggest one, and the one that we keep hearing stressed first and foremost, is going to be testing, tracing, and isolation. So testing the people that are sick, testing the people that have symptoms. And we've now seen that Los Angeles, at least here in the county, if you have symptoms, everybody can go get the test. However, it's going to be much more than just the people that are showing symptoms. As you just heard Tom talk about, those women that were pregnant that had no idea. It's all about testing asymptomatic carriers as well. So Los Angeles and California as a whole, they're making progress in that direction with the antibody tests, but nowhere near the level that we need so that anybody, whether they're showing symptoms or not, can go get tested. So that's number one, testing, tracing, and isolation. Number two is really about shoring up the medical community and making sure that the healthcare sector has what it needs to deal with any type of potential surge. As you can tell from what we just talked about, they're making progress in that direction. Number three is really about imagining or reimagining what society is going to look like when they reopen. So that means that they want to have things in place where they can scale back the amount of people that are in restaurants or scale back the amount of people that are visiting establishments. Another thing is the possibility that in a couple months from now, if you want to go to a restaurant, you're going to have your temperature taken before you're allowed inside to dine. So that's just possibly going to be the new normal that we see down the road. And lastly, it's really about making sure that there is some sort of therapeutic potential for something like a vaccine or something that can bring California to that herd immunity to make sure that more people aren't getting sick. Allison?
Gadi, thanks so much for the California update. Stay safe.
You too. Thank you.
By the end of this week, the Department of Health and Human Services will have delivered $30 billion to U.S. hospitals. That is a fraction of the $100 billion earmarked on the federal coronavirus package. President Trump explained how the rest of that money will be distributed during a meeting with healthcare execs.
Soon, HHS will distribute additional funds from the remaining $70 billion provided in the CARES Act, a big deal to get that passed. A significant amount of this money will go to the hospitals and hotspots, while a portion of it will reimburse hospitals for the cost of treating uninsured patients and for the coronavirus.
But an NBC analysis found that so far, hospitals in some major hotspots are being shortchanged. NBC News political reporter Josh Letterman is behind that investigation, and he's here with me now. Josh, what did you find?
Well, you would think, Allison, this money would have been doled out to the states that need it most. We've been hearing about New York, New Jersey, California, the states with all of these cases. But here's what happened. The government wanted to get some of this money out the door as soon as humanly possible to hospitals and doctors that need it. And so they used the best source of information they already had on hand, which turned out to be Medicare spending rates from last year. So this first $30 billion tranche went out based on how much each hospital or doctor got in Medicare billings last year, unrelated to COVID. And so as a result, we're seeing major discrepancies, such as West Virginia, with just 702 cases, hasn't been particularly hard hit so far by coronavirus. They got what amounts to $351,000 for every case they have in the state. Now, just across the Potomac River in Maryland, they have 10,000 cases, a much larger number. And as a result, if you look at how much they got per patient, it turns out to be only about $74,000. We're seeing this play out really in all parts of the country, such as Louisiana, another state we've been talking about, that hot spot in New Orleans and other places in Louisiana. They've got almost 22,000 cases in Louisiana, got about $21,600. If you take how much Louisiana got and you divide it by how many cases they have, just over the state border in Arkansas, they've only got 1,500 cases. They got $209,000 for each one of those cases. And we've really been seeing some concerns expressed by officials, especially in New York and New Jersey, some of the hardest hit states in this pandemic so far. New York, for example, with its 203,000 plus cases, only got about $9,000 for each one of those cases they're dealing with, while just over the state border in New Jersey, where they've got 71,000 cases, they got just under $13,000 for each one of those positive coronavirus cases in the state.
Josh, I know you also found that some hospitals got next to nothing. Who's being left out here?
Well, if you think about it, Allison, who gets Medicare money and who typically bills to Medicare, there are certain groups that just don't, such as children's hospitals, because there are almost no children in the U.S., obviously, who are on Medicare in the United States. Also, obstetricians who don't have a ton of clients who are of Medicare age also got left out of this. And then rural areas and those that have more people on Medicaid, which is for low-income Americans, they've got less people on Medicare. So proportionally, they got far less than states that have larger numbers of Medicare recipients.
Josh, you mentioned, the New York and New Jersey not getting what they need. A group of 36 bipartisan lawmakers in those two hardest hit states wrote a letter to Congress. What are they asking for, and what are they saying that needs to happen here?
Well, really, they're interested in two things, Allison. First of all, they want the rest of this money as it's being doled out, the $70 billion that's left. They want that to be apportioned more according to where there is the coronavirus need. And we've heard that echoed by Senator Chris Van Hollen of Maryland, who wants the same for Maryland and other places. But specifically in the New York, New Jersey area, they also want a separate $45 billion fund that Congress should create, in their view, in order to deal with the real onslaught of cases and all the expenses that come with it that are being incurred right now by New York and New Jersey as they try to make their way through this pandemic.
Josh, unbelievable numbers there. I know a lot of hospitals could use much more help than they're getting. Thanks so much for running us through what you found.
Thanks, Allison.